when you're doing an IUI, there are no restrictions to have intercourse until you are instructed to take the trigger shot. From that night until the day of insemination, the husband or the male spouse should not ejaculate so that the sperm can have a couple of days to build up and we have better counts for the insemination. So the more sperm we have on day of ovulation, the better chances we are that one of them will find the egg, fertilize it, and you can become pregnant. For an IVF cycle, after about 4 or 5 days of injections, you should use barrier contraceptives, meaning you should use condoms or avoid intercourse altogether. After the retrieval, you probably won't feel like having intercourse anyway because your ovaries are bloated and you're sore and you just had surgery with the needle going through your vaginal canal. But once you're at a point where you can have intercourse, you have to use barrier contraceptives until your next period comes. So when you're doing a frozen embryo transfer, up until the day of transfer, you should use barrier contraceptives. And then after the transfer, although there's no reason why you can't have intercourse, our doctors recommend that you do not have intercourse, that you avoid it until we know if you are pregnant or not. After you are pregnant, if your first blood test comes back positive, then we recommend no intercourse until you're 10 weeks along. That is so that, God forbid, something should happen with the pregnancy. If you miscarry, because you're going to miscarry, you can't blame yourself that you avoided intercourse all these days and then you had intercourse and the next day you miscarried. The two are not related, but women seem to beat themselves up about it and they're gonna think about it and it's never gonna leave them. So we say no intercourse all the way until you're 10 weeks along.